Hello and welcome back to Ascend with Courtney Smith. Today I am here with Dr. Alexa Hecht, who is a board certified optometrist right here in Toronto, specifically Leaside, specifically Bayview Vision. I met her getting my eyes checked. I took my 1-year-old baby boy, Paul. We took Lauren, 4-year-old Lauren, got her eyes checked. My husband dragged him off a Zoom call and got his eyes checked and got my own eyes checked. I got some glasses, a great experience. Highly recommend Dr. Alexa. She has nearly 5 years of experience providing comprehensive eye care for patients of all ages. She has a special interest in diagnosing and managing dry eye disease. Fun fact, we'll talk about that.
Yeah.
Practices as an associate at Bayview Vision, which is where I met her, down in Leaside on Bayview, and has recently started her own practice inside Forest Hill Optical. I'm so excited for you. That's amazing. Hecht is also passionate about public education, sharing evidence-based tips on eye health and eye beauty and makeup habits on social media. Actually, I looked you up on social and I was so impressed. You are like the most fun eye doctor I've ever seen. I'm gonna request everyone follow her. We'll plug her at the end. She also co-hosts an optometry podcast. I didn't know that.
Yeah, not as professional as this, but.
I mean, this is not that professional, but optometry students and new graduates. So without further ado, Alexa.
Thank you for having me. This is so fun.
Are you kidding? This is so much fun. I don't know, you really left an impression on me when you did our eye exams for my family. I came and we booked an appointment and you were so professional but relaxed. You were so good with the kids. You helped me manhandle my husband a little bit. And we just got everything we needed to get done. I also had no idea that kids' eye care is covered under OHIP.
Yes.
So up to what age can kids get their eyes checked for free?
Well, first of all, thank you. That's like, honestly, one of my main goals during an eye exam is to make people feel comfortable. And so whenever I get that compliment or someone tells me that, I'm like, goal achieved.
Aww,
Thank you.
Sure.
And yes, I see a lot of kids, the ages of 0 and 19, you are covered under OHIP, which is every year.
That's crazy.
And then any follow-ups, any red eye emergencies, anything you need, we'll see you.
That's crazy.
So yeah, a lot of people don't know that, which it is crazy because people aren't coming annually. You should bring your kids because you never know.
That's so true.
Yeah.
That's so true.
Kids were so cute.
Oh, thank you. I know Paul was having a rough day, so I was like, giving him a bottle. We were taking breaks. You're like, let's just give him a minute. You were letting him play with your super expensive equipment. It was really kind and thoughtful.
That's really nice of me because that's really expensive.
I know. Trust me, I know. I was like, I can't believe she's letting him play with that, but okay.
Yeah.
No, that's amazing. So what made you want to become an eye doctor?
I always had a passion for science, healthcare, but then I also loved beauty, makeup. And so what better world than optometry to combine both of those fields? And I kind of was inspired by people in my life. I had a neighbor who was an optometrist. My dad's best friend's an optometrist and owned a very successful practice. So I figured, this would be a good career for someone who later wants to have a family soon and wants to eventually, be able to work part-time, maybe own my own business. And I just kind of went in and did it, and here we are.
Love it. Yeah. And you've been doing it now for 5 years?
Yeah, almost 5 years.
Yeah.
And I'm from Winnipeg originally, but I to University of Waterloo, and then I just stayed in Toronto, met a boy, and the rest is history.
So you live in Forest Hill?
Yeah.
And you work in Leaside and Forest Hill?
Yes.
Is your husband from the Midtown, Uptown?
He
okay,
is.
That makes sense.
Like Lawrence Park area.
Yeah. What do you think of the neighborhood? Like, what do you?
It's amazing.
I know. I know.
I mean, the practice on Bayview is a perfect location. Yeah, Midtown's home.
I know.
I lived downtown for so many years.
Yeah.
It's fun when you're young and want to go out, but now I'm settling.
And I know you said you want to have a family and you will soon. And as someone who was raising her family in Midtown, was my dream, is my dream.
Yeah.
It is so great for families. Everyone in Midtown just is so family oriented. It's all about the kids. Literally grandparent aged people will stop and want to know what the kids' names are and how old they are, what school they go to.
Yeah.
And it has so much community and so much heart and so much history that it's Toronto, but it's not that cold big city vibe that it has a reputation of being. So I think that's
a small little
community. It does. Yeah. Forest Hill Village is that too. It's very community oriented. It's a village.
Yeah, exactly.
Yeah. So I have a question about eye care.
Okay, I love it.
Yeah. So eye makeup. What are the do's and don'ts for eye makeup? Let's talk like what mascara are we like eyeliner on the waterline,
Yeah.
90s girls. Like, what are the do's and don'ts of best eye care practice for makeup wearers, daily makeup wearers?
Okay, I would say number one is you want to make sure you're removing your makeup properly. Getting a good double cleanse. I like my micellar water to remove it, and then I'll go in with a really gentle face wash and just kind of make sure everything's off. If you're waking up and cleaning off your makeup that's sitting here in the morning, you didn't take it off properly the night before. I'm a proponent where I don't want you to stop wearing makeup. So I'll never tell a patient, you know, just stop, because they're just not going to. People want to feel pretty. They want to feel elevated every day. And I love makeup. So I think it's finding ways to use makeup properly and safely, and especially with all these eyelash procedures, which we can get into.
Let's get into it.
Yeah.
So let's start with eyelash extensions. Yay or nay, and why? And what kind?
Okay, nay. I'm gonna say nay.
Okay, I understand they burn. Like, it burns your eyes. Like, this can't be safe.
If you're sitting getting a procedure and you're uncomfortable, something's wrong, right? And if you want to get it every once in a while and you have no reaction, you feel okay after, fine. But it shouldn't be part of your monthly routine.
Okay.
Because firstly, a lot of people have reactions to the glue that is used. That's very common.
Yeah.
Our eyelashes are not supposed to be that long. And so things are getting trapped. Honestly, I've never seen a clean eyelash extension, and it's bacteria, it's buildup, it's mites that are growing on your eyelash extensions.
Oh my God.
So it's pretty nasty.
Yeah.
And
I am a recovering eyelash extension addict. I used to get it done religiously through my 20s for sure. And then just from, from going on a beach vacation, I just want to feel pretty, but I'm going in the ocean. I would get it done once or twice a year, but I've stopped getting them done, but I do miss them.
See, I think you look beautiful without them.
Oh, thank you.
I just feel certain people do it well, and it looks nice for the first, 2 weeks.
True.
But then the
high
maintenance is nasty.
Okay, so what about strip lashes? Gluing on daily strip lashes. What about those?
I'd actually rather that.
Or individual. Oh, because you wash it off every night.
Yeah, you take it off every night.
What about the new semi-permanent where you glue them on and you leave them on for a week or two?
Like clister lashes.
Yes, exactly.
Yeah. Again, that's better to me than lash extensions.
Interesting.
Depending on the glue and how long, if you're properly cleaning around the eye area.
What about the daily magnetic ones? You put them on.
I've never tried them, but that sounds good because there's no glue involved.
Exactly.
They just might be a little heavy.
Yeah. What about the beloved Latisse?
Okay.
So it's the lash growth serum that I think is medicine?
Glaucoma.
Yes, glaucoma.
Yeah.
Okay, so what do we think?
I'm glad you know that. You're at some sort of medication.
I did my research. Yeah.
So
are you yay or nay, and why?
I'm nay.
Okay.
I'm
like
not.
a hard nay? Or
Yeah. The side effects are pretty nasty.
Okay.
So Latisse and other lash serums that contain what we call a prostaglandin or prostaglandin analog, which is a derivative of glaucoma medication, which is used to lower eye pressure, has some great side effects. It grows your lashes beautifully and really quickly.
Yeah.
So a lot of my glaucoma patients have these beautiful long eyelashes, and have you noticed it's from the drug that you need to be on.
Yeah.
But one will give you that sunken eye appearance.
He's not looking. Okay. And will give you that sunken eye.
It
will give you a sunken eye.
Yeah, it orbital fat atrophy around the eye. So
oh my God, I'm never using it again. I used to use it.
Yeah.
It is addicting.
Yeah,
it's better than lash extensions. It's just my lashes.
Yeah.
Looks so natural.
Two, you'll get redness, and almost your eyes will look just more red because they're drier. The skin around the eye can darken. It can actually darken the color of your eye.
That's insane.
Yeah. So I don't know. Dry eye styes, all sorts of things. Look for a lash serum that is peptide based.
So my next question is, are there lash serums that actually work other than Latisse? Because I've used Latisse.
Yeah.
It works charm.
Yeah.
And I've used 3 or 4 or 5 other expensive $100 serums. They don't work.
I know.
Because they're just like nutrients?
It's like peptides. I've tried one, Swede.
Swede?
I like that one. It's fine to use.
Okay.
I'm using one called Lash Food right now. I don't know if you've heard
I've
of
heard of that one. Does it work though? Does it have the Latisse effect?
No.
I know.
You're not
nothing
going to
will.
get that.
I know.
And I always
Okay.
tell people, I'm like,
Just accept the length of your natural lash.
yeah.
Okay.
Yeah.
Okay.
Curl your lashes, wear mascara.
Yeah.
We can talk about waterproof products because
Waterproof mascara.
Yeah. So a lot of people who love waterproof I love my waterproof mascara. It holds the lash. I agree. Your curl's going to last longer. You won't get that raccoon appearance. The issue with waterproof makeup is it's harder to remove, so you're going to be tugging.
I know.
And the other thing is it doesn't dissolve in our tears, so all that buildup and kind of forever chemicals, as we like to call them, that make them long-lasting or products that are long-lasting will kind of sit in your tear film and can cause irritation and dryness. So
interesting.
I recommend looking for something that's more not waterproof or water resistant, but there are some really good mascaras on the market.
Run less.
Yeah,
Okay.
yeah. Even prefer blanking on the name, where it kind of coats the lash.
Oh yeah, the tubes.
Yeah, tubing mascara.
Yeah.
That has its issues too, but I put tubing mascara
Okay.
over waterproof.
Next question.
Yeah.
Filler. What's your
Okay.
opinion? I don't have any. I do want it though.
Okay, you have to be very, very careful with under eye filler.
Fair.
It can lead to blindness.
That's insane. It's not worth
if it's not.
I actually
done
saw a
properly.
content creator.
Yeah.
Did you see the same one from Korea? The one that was having
I did
blind.
a video on that.
Oh my gosh, that's
It
so
was very
Or maybe
scary.
that's where I saw it from your account.
Yeah, probably.
Yeah.
You also have
Yeah.
to be really careful with in the nose because it's all can
What about
be linked.
Botox around? Is that any risk with that or not really?
There can be. You can get double vision and stuff, but the nice thing about Botox, it's temporary.
Yeah.
Right? So
solves.
I'm fine with Botox.
What about
Yeah.
eye fat transfer? This is
Yeah.
conversations that are coming up in the mom group chats.
Okay.
We're tired.
Yeah.
We have these dark circles.
Yeah.
We're losing some fullness under
Yeah.
here. And there's one doctor in particular that has these under eye fat transfer procedure that the results are dramatic. They
Where
look
do they take the fat
so
from?
good.
Other parts of your face?
Other parts of the face, I guess,
Okay.
or maybe here,
Oh.
nearby. They're not taking it from your butt or anything, but
Okay.
yeah, and they fat transfer it. But I wonder what if you are putting something there, but it is
Yeah.
your own.
I honestly don't know too much about
Yeah.
it, but I'll have to do some research on that.
Mhm.
If that's coming up in the group chat, I got to know.
I know, you got to know. That's what the girlies are talking about.
Interesting.
I know.
Yeah, I guess that's one of the biggest concerns people have is dark under eye circles or,
Eye creams, retinal
Yeah.
eye creams,
Yeah.
or how close to the eyes are you getting?
yeah.
My other question for you is if you're using a facial cleanser or a product that burns your eyes, you should probably not use it.
Yeah.
That's
Good.
insane.
Great.
Yeah. So, and I hate to throw them under the bus,
Yeah.
but I got this overnight eye mask from that French brand L'Octane or
Yeah.
Octane or whatever.
Yeah.
But it's so scented that if I get it anywhere remotely close to my eyes, it
Burns.
absolutely burns
Yeah.
my eyes.
Yeah.
And then even while it works in other areas, I just don't want to use it because it's so fragranced.
Yeah.
I find that with sunscreen too, getting sunscreen in the
Yes,
eyes.
burns.
Why is it so brutal? Why is getting sunscreen in the eyes so brutal? Why don't they make eye-friendly sunscreen?
It's usually because it's one, you're sweating too if it's getting in the eye. So it's salty sweat with your sunscreen.
So true.
That's why you have lashes and brows is to catch all that stuff.
That's crazy. That's the purpose.
Literally.
Yeah. I just think it's to look cute.
And that.
Lashes and brows are so cute.
It's so important.
But it is so important.
No, yeah. So
Oh, interesting.
I love these rapid fire. Keep them
I
coming.
know. I just want to ask all the eye care questions. So next up, SPF, sunglasses. How important is it to protect your eyes from the sun?
Very important. And I
Yeah.
think that's the number one thing people can do. That's such an easy step. And sunglasses are cool now. And
Yeah.
they're
gorgeous.
weren't. When our parents were growing up, grandparents, they didn't really wear sunglasses we do today.
Yeah.
So look, there's this whole thing. We do need a little bit of light in the morning, and not all UV exposure is bad.
True.
So, I'm okay if you wake up and want to get some sunlight into your eyes in the morning and you don't have 100% sun protection all day.
Yeah.
But if you're going to be out in the sun, even in winter, it's so important to have that UV protection.
Interesting.
And yeah, make it fun, make it
Yeah.
cool, have multiple pairs of sunglasses.
Right?
Yeah.
Yeah.
It's sunscreen for your eyes. And so it's
Yeah.
protecting not only the front surface of the eye, the white of the eye, the skin around the eye,
Yeah.
where skin cancer is very common,
So true.
but also the back of the eye.
So true.
So overall,
Yeah.
protecting your future eyes.
Future eyes. I love it.
Yeah.
What is the number one misconception that you see in your practice where a blind spot, pun intended, but what's something you see people not taking into consideration? I know that with my husband, he doesn't wash his face with face wash because most men don't. So there's eye buildup on his eyelashes or something, and you recommended an eye cleansing pad or something, or a toner or whatever. So what are some things you see in your practice of blind spots or gray areas that people aren't thinking of for their eye care?
I think you said it. Number one, people aren't cleaning around the eye area, and
really getting there.
Women do because they take off their makeup. Naturally, you clean. But to me, it's like you brush your teeth, you floss. You have to clean your eyelashes.
So true.
And yes, it's more common in men. I always am checking my husband. I'm with my.
He's like, get away from me.
It's like, I think I see a little crud there. But yeah, you're right. He doesn't wash his face. Call out to our husbands. But
splash of water. That's not going to get in
like
there.
Perfect skin, right?
Oh my God. So supple. It's not fair.
Unfair. I would say that. I think people get really caught up on blue light blockers. And
so what's your stance of blue light blockers? Do they do anything?
Not what is marketed.
Yeah. They're basically, you can be on your phone all night as long as you're wearing your blue locking glasses, or you can be on your computer all day as long as you're wearing your blue lock. But it's maybe you shouldn't be straining on a screen all day.
Right.
Isn't that the point?
I'm a fan of them if you're going to be late nights working, because it does affect your melatonin levels. But I don't.
Oh, so you are a fan of them for late night?
Yeah.
Oh, so that's one of the actual intended.
Yeah.
Okay.
I agree with that, but I don't think or just turn on your night shift mode on your screen. It's the same thing.
Yeah.
I don't think you need them all day, every day.
Okay.
If you want to add them into your glasses prescription just as an added kind of coating, fine.
Yeah.
I don't wear correction every single day, and I'm staring at a screen and I don't have it. So I think that kind of speaks for itself.
Yeah.
People are buying for their kids, and I think there's other things we can do aside from blue light blocking. Sunglasses, having a good pair of computer lenses that actually have prescription in them to help relax your eyes, that will do more. Yeah.
Interesting. The other question that I mean, part of this is I'm just asking all my selfish questions of things I want to know about eye care. Case in point, all the cosmetic questions.
Yeah.
But above and beyond that, what is something someone can do for eye care? Should they be doing eye exercises, or should they be doing, what are some eye care best practices to have? Obviously, we all want the best eyesight for the longest possible time period, going into 80s and 90s, and we're living longer. And what are some things that we can do? Either what are some things that are really bad for our eyes that we should minimize, maybe watching TV in the dark or something?
Yeah.
And what are some things that we can do to kind of help protect our eyes for the future?
Okay, I would say number one, we're not blinking enough.
Interesting.
And that's just like such a simple thing. It's because of our screens, we're blinking 30% less. So as a society, we can all blink more.
Oh my God, that's breathing more. That's exhaling, right?
Yeah,
like,
but it's something you don't think about because you shouldn't be thinking about your blinking. And now you're going to start blinking.
I'm like, okay, I need to blink more. Okay.
But it's because our devices are so stimulating that we're just staring at our screens and not taking enough breaks. So, everyone's probably heard of the 20-20-20 rule. Every 20 minutes, get up, look at something 20 feet away. And this gives your eyes a bit of a break.
I don't think I knew that.
Okay, well, there you go. Me, it's supposed to be for 20 seconds. I think you should take a longer break than 20 seconds and maybe go walk around, go to the washroom, grab a snack. Like, give your eyes that rest from your device. And the consequence of not blinking enough is
dry eyes.
And
which is also wear and tear on your eyes.
Yeah, it's our oil glands. Every time we blink, our oil glands push together and oil comes into your tears. So if you're not blinking, or a lot of people have these half blinks, it can lead to dryness, irritation, and long-term effects.
Interesting.
Yeah, so that's my number one thing. People ask, blink more.
That's so easy.
And you can do blink exercises if you look them up.
What? That's so fun.
Yeah, you can retrain your muscles in your eye to properly squeeze and blink without this forceful blink.
Interesting.
Yeah.
Okay, I'm looking this up for sure.
Yeah.
The other question I had was around, I lost my train of thought. It was so good too. It was a good question. Blinking, eye care. Oh, kids. Eyes and kids.
Okay, I thought you were going and wondering having kids.
Yeah, no. Kids. Are we having them this soon or no? I guess best practice eye care tips for babies, 1-year-olds, toddlers, school-age kids. Like, I guess just get their eye exams annually, make sure that they're looking good. But
yeah, I think what
like
you
my daughter
should...
doesn't wash her face.
No, and they shouldn't.
Yeah,
They're
okay.
too young. I think what things you can watch out for to know if there are any, lazy eyes, eye turns. That's very common. People come in, they're my kid's eye is turning inward.
Got it.
Out for things, head turning while watching TV. One eye. Tilting even, going really close to things. So that can be a sign that maybe there is a glasses prescription that's needed. Again, I just bring them in because we have ways to check kids that we don't need their answers. I never rely on a kid's answer ever.
Perfect. I know. I was so impressed by that. I was like, how are we checking Paul's eye?
Yeah.
How are we checking Lauren's eyes?
Yeah.
This is crazy. Yeah. It's so cool.
We don't really care what they say. We just want to see, are their reactions okay? Is their tracking okay?
Yeah.
So there's many ways we can do it.
Yeah.
But I think, it's also about the activities they're doing at home and, coloring and paper and using their hands-eye coordination, sports.
Yeah.
Right?
Yeah.
Activities. So
God,
getting outside is really protective for their eyes too, I will say.
Because you're looking at things close up, far away.
Yeah,
or
there's something about the sunlight that is protective for their eyes and preventing nearsightedness or myopia. There's a huge epidemic happening right now where about 50% of people will be nearsighted by 2050.
Oh my gosh. Is that because of screens? Indoors and screens.
Indoors, screens. Our eyeballs are elongating at a rapid rate, especially in children.
Yeah. So outside.
Get them outside 2 hours a day. It's recommended.
Really?
Yeah.
I love that. That's an eye doctor recommendation.
Yeah. And with reset and studies, you can look it up. But studies shown that 2 hours a day is really protective. And they go out for recess. That's, that morning, afternoon recess. And then
lunch before school,
walking
after
to school after.
Yeah.
So they are getting outdoor. Yeah.
Oh my God, this was so good. Will you come on again?
Oh my God, we're done?
Yeah. Wasn't that so good? Yeah. Quick, easy, fun. Did you have fun?
So fun.
Yay! Oh my gosh.
Yeah, definitely book your eye exams.
Okay. I already want to come back. When was I there last? Like 3 months ago.
Not even. I don't.
Really? Yeah, probably. A month ago. Get your eye exam at Baby Vision. Ask for Dr. Alexa Hecht. I've sent people to you before. I always tell people
thank
about
you so much.
Yeah, of course.
I really appreciate
Thanks for coming on.
Yeah.
It's so nice to have a local Midtown resident, optometrist, business owner. Congrats on your new venture.
Thank you.
And yeah, thank you for, honestly, I had such a good experience, and I always love when a lease-side business, specifically on Bayview, self-interested, it's walking distance from my house, is a great business because it's somewhere that I can go, that I can refer clients, friends. I love supporting local businesses. So take your kids to Bayview Vision and tell them Courtney sent you. Ask for Alexa. And send this to someone because, we all need to take better care of our eyes.
Yeah.
Aging healthy, aging well, and some good eye care. Okay? Like, subscribe for more. See you later.
Loved it.